So I'm beyond honored today to introduce our keynote speaker, Julia Cheek. She's the CEO and founder of Everlywell, the digital health company poised to disrupt the $25 billion lab testing industry by providing consumers with at-home lab tests that include insightful, easy to understand results. A seasoned entrepreneur, she's taken the stage at conferences like Fortune's Most Powerful Women Summit, South by Southwest. She is passionate about two things: increasing the accessibility in healthcare and inspiring the next generation of women leaders. This year, she's been honored by Entrepreneur Magazine, Inc. Magazine, and Create and Cultivate as one of the most inspiring women entrepreneurs of 2020. And she was also included in the Fortune magazine's 40 Under 40 list for her work to fight the coronavirus pandemic. These days, she's focused on two things: running Everlywell and being a new mom. Julia is also one of the most generous leaders I know, and I know that all of you in this room share that feeling. She's inspired all of us. So, Julia, thank you so much for being here today. We know how busy you are, and it means a lot, and all of us are excited to hear your words.
I am super thrilled to be here. I tried and was successful in opening up my calendar so I could listen to the last few pitches, and I am super excited to be able to maybe put a little bit of an exclamation point and emphasis on some of what I just heard, and I'm really inspired by each of you. Susan, it was a very generous introduction. Susan and I met several years ago at one of our own accelerators, and it just is speaks to the power of bringing women together that are focused on the same issues and how we're able to mentor, support, be colleagues, be friends with each other over the years. So I'm honored to be here. So I can only share with you a few insights that comes from both still being in your shoes as a founder and entrepreneur, and potentially having a few years of scaling experience, and in really looking at the women's health space and driving change as a founder in healthcare, with about a 5-year view now. So I would love to share a few points, both related a little bit to my founding story and what I experienced in that, as well as my current thinking around some of the critical issues in femtech, the fertility space, and many of the underfunded categories. Actually, two pitches of which I just heard in these areas. So, if you will give me the stage for I only have about 15 minutes, so hopefully I'll be able to share something insightful that you can take away from this and be inspired by. So it's interesting to reflect back. I started Everlywell here in Austin, Texas, in 2015. For those of you who are likely not familiar with my story, I was not a healthcare entrepreneur. I was in payments and working at a public company. I had never been in the healthcare space. I was a first time founder, a non technical founder, and a female founder. And so I really came at this idea because I was so personally moved by my own experience in lab testing and the medical odyssey that I went through and the thousands of dollars that I had to pay for basic tests, that I wanted to bet my life's work on it. And so that to me was such a driver and how I was catapulted into this space. And I often say, I don't know that I would have gotten into the space of being a healthcare entrepreneur if I had actually known how hard healthcare was. But I am honored to be doing what I think is the work of my life and my career now, in this space on behalf of women and all Americans. When I was seeking venture funding, I raised about 75 million in venture funding to date for Everlywell. When I was first seeking funding in 2015 and 2016, I had significant pushback that I am sure all of you have faced, and in very similar, probably commentary. And I'm hoping it has gotten better in 5 years. I can't confidently say that it has. Some of the pushback I faced was that my product, our first three tests, we have over 35 different tests, for men and women and for everyone. And my first three tests, though, were focused on fertility, breast milk, nutrients, and on hormones, thyroid metabolism, and then dietary and vitamin tests as well. These are all traditionally both female focused types of tests. That's who is the consumer of these types of testing, as well as particular, obviously, to women. And so when I started raising money for this, all of the feedback was, well, I don't know that there's a market for this. No one will ever pay for these products because insurance covers all of it. There is not a market here, and this is not a problem. And the reason I was told it wasn't a problem is because I was not pitching to anyone who had ever experienced the problem. And it took me 3 years, and until we were delivering $12 million in run rate annual sales for me to be able to raise a dollar of venture capital funding. And even at that point, it was in a convertible note and not in a price round. I had a number of privileged advantages. I have a Harvard Business School degree. I know someone at almost every VC firm in the world. That doesn't mean that they want to give me money, but I do know them. That is a significant advantage in a place of privilege. I had a lot of things going for me, and it was still very, very, very difficult. And I remember when I was raising money back in 2017, there was a Bloomberg article that came out that it was some headline I'm sure many of you remember about like the bikini health industry. Um, and it was so eye rolling for me to see that women's health venture investing had become hot because it was an untapped market, and yet we are more than 50% of the population. And so when I see this space today, I am hopeful, but I also just want to remind you all that it is never easy, and yet it can be very successful and rewarding. And so anyone who is sitting in my shoes today who now has the privilege of raising rounds that are oversubscribed because that's how typically funding works. There tends to be patterns. Once you do it once, it gets easier. I have been in your shoes, and the work you are doing is important and it is worthy and it is going to pay off. And so when we launched a bunch of our tests in 2017 and 2018, once I was able to get funding, we were actually first to market with an at-home self-collected fertility test with a number of hormones. And it was very difficult at the time to paint the picture about why that was important for women. There was this continued conversation around, well, it's paid for by insurance, it's covered, it's all of these things. And so I've done a lot of work into the disparities of how the healthcare system is set up to disenfranchise women from how, and I heard a couple of comments earlier, but from how clinical trials are conducted, to how products are designed, to how women are treated, even to how much they pay. And so I thought I would share a few points with you here before turning to areas where I think we can really drive change and rallying around that. So, I think the femtech space overall, it is so there's so much weight with that phrase, and it really is in ways a band-aid. Because what we know is women's healthcare is actually just healthcare. And all of these kitschy phrases that we put around it, I think, devalue the importance that women's healthcare has in just driving the majority of society's wellness. And women do not feel heard by the medical system. 1 in 5 women report feeling ignored by their doctors. More than 40% of women who are eventually diagnosed with a serious autoimmune disease had been told by at least one doctor that they were a hypochondriac. And then there's just, again, this gender bias in how things even become common treatment and protocol. It is widely acknowledged in the medical community that medical training is based on an average patient who is male, white, and 75 kilograms. There's gender bias in clinical trials, and even now and historically, we know that women in childbearing years are typically excluded from clinical trials, in part to protect them and their fetuses from adverse effects, and yet they don't feel that they can adequately control these variables, and so you oftentimes aren't able to get the care that you need because the trials haven't been conducted. There's also this underlying real tenor that researchers feel that women's hormones often create a contributing factor of not being able to control certain variables. And so this impacts ultimately the actual physical health, but also the financial health of women. Americans' most recent surprise medical bill was $520, but the average was hundreds of dollars higher for women. Women's average total surprise medical bill is $725, while men pay $329. It is over double for women versus men. And so all of these problems end up creating all of you that are here today, as well as people like me, who demand better and who are unsatisfied with the status quo that was never built to serve us. And I also think beyond that, I'm speaking specifically about women right now, but femtech really has to be intersectional to truly serve all women. And this might be a little controversial because I do think there's a lot of strides we need to make in fertility, but there is a focus in hotbed areas like fertility, and yet so many areas that go underfunded. We need to prioritize solutions and treatments for a more diverse set of women. The LGBTQ and trans population, women with chronic conditions, aging women, women in vulnerable racial and ethnic groups, women with shift jobs, multiple jobs, trying to make ends meet. There are different solutions required to solve these problems for all of these groups of people. And the industry really needs to invest, yes, in reproduction, but also beyond it. Funding is already scarce, as we know, and the lion's share goes directly to fertility, oftentimes because that total addressable market, unfortunately, is valued based on the cost of IVF treatment. And so I think that there are real gaps in other areas, which are many of the solutions that I heard today. And I'm really excited to hear that because you're already focusing on the areas that are still underrepresented. Another challenge that we know is that fertility and pregnancy solutions that do exist are often not reaching the people who need it the most. Black and Hispanic women are less likely to seek or have access to pregnancy and fertility services, despite having higher rates of infertility. And LGBTQ individuals face very high barriers of accessing fertility care, or they don't meet the definition of infertility that would qualify them for covered services. This is especially impactful for transgender individuals, and it absolutely has to change. So as we think about what can we do from here, I've shared a lot of frankly, really depressing information, right? But I see that as opportunity. What I see that as is this incredible group of people investing in supporting founding companies in these spaces that are ready to tackle these critically important world-changing problems. And so I see these areas that I think are real opportunities for entrepreneurs and founders and for this next generation. LGBTQ healthcare, 1 out of 5 adults in this space avoid care due to discrimination. There have been some inroads made, but very few. There is a mortality crisis for Black moms. Protecting our Black moms is not only a moral imperative, but a huge opportunity. And then older Americans, menopause, symptom management. This is such an important area where women have just really been ignored. And so the list goes on and on and on. Everything from osteoporosis, depression and mental health, heart disease, the #1 killer of women in the US, and yet not a lot of women-focused treatments, bladder control, UTIs, pelvic health. All of these are areas that deserve just as much attention as the reproductive space and affect women at one point or another throughout their life. And so as we look at this space and what we can do, all I see is opportunity. All I see is a space that is just emerging and has become sometimes defined by something that my company serves, which is reproductive health, from STIs to fertility, et cetera. and sexual health. But it is really just the beginning. It is the tip of the iceberg of giving femtech and women's health the full view of what this means. And it is putting us, I think, as founders in a box to assume the narrowness of this space. I view this as simply healthcare, and I am really excited about the opportunity ahead when I'm able to hear from and be inspired by people like you doing world changing work on behalf of women. So I will wrap my remarks there. I'm going to stay on for a little while and listen. I am grateful to be here just learning from each of you. And I hope ultimately you remember that this work is incredibly difficult. And that means honestly that it's worth it. It's difficult, it's harder than the average person's experience. You will hear more no's, but all it takes is one yes, one path to building your company. I am nothing special. I am the same as each of you and likely less qualified in many ways to be in healthcare. And yet I didn't give up, and that's the only difference. And so I know that each of you can do it too. And each of your companies is solving such an important problem in this next generation of femtech. And so I'm super excited to see where you go. Thank you.
Wow. Thank you, Julia. I'm so grateful for your honest words and advice to all of us. It was really useful. You are absolutely amazing in every way. And it's just a real honor for us to have you here with us. And
Thank
I
you for
really
having me.
appreciate the call to action. I think that's why we're all here. This is a community we're building. So, very grateful.